Hello and welcome. The McCormick Foundation is delighted to host our forum today. We look forward to sharing the research results that our nonprofit partner, Blue Star Families, conducted over the past 2 years regarding our military and veteran connected families in the Chicago and greater Illinois area. Whether you're an ally of the military and veteran connected community or a member of the community, this next 45 minutes a greater understanding of the community in the greater Illinois region and how we can better support them. The McCormick Foundation envisions a Chicagoland comprised of thriving communities where all individuals have the resources and opportunities to succeed without regard to race, income, or ethnicity, gender, or zip code. Since 2017, the foundation has granted more than $200 million to nonprofit organizations working to build thriving communities in Chicagoland and across Illinois, with an emphasis on Chicago's south and west sides. One of our partners is Blue Star Families, whose groundbreaking research is raising the nation's awareness of the unique challenges of military and veteran family life. We're proud to partner with Anne for many, many years with Blue Star Families and look forward to not only reviewing the study over the next 45 minutes, but also sharing tangible solutions during this event. I'd now like to introduce Kathy Roth, founder and CEO of Blue Star Families. Kathy, thank you for joining me today.
Thank you so much, Megan. And it's so great to be here with you. And we appreciate McCormick Foundation so much for all they do for Illinois, for veterans, and for really helping us here in Chicago and across the country. We've had more than 7 years of partnership with the McCormick Foundation, which has meant all the difference in the world in us being able to develop, test, and deliver solutions for military and veteran families in Chicagoland and beyond. We're really, really pleased to be joined here today with two very important partners for Blue Star Families, two incredible leaders for veterans and military families across the space in Chicago and Illinois. And that's, of course, our partners at the USO and Illinois Joining Forces, who are going to be with us on the panel shortly. For those who may not know, I want to let you know who Blue Star Families is. Blue Star Families supports the currently serving military, active duty guard and reserve, wounded and transitioning service members and their families. And increasingly, we're serving veteran families too, because we find across the country, they're making up 20% or more of our membership. Our theory of change is listen, share, partner, and act. We listen to our community. We share what we know with our partners and we gain from what they know. We partner with the right folks, such as the McCormick Foundation and Illinois Joining Forces in the USO, and we act to make a difference, and we see how that works and see what needs to be done. We are very excited about the information we're going to present to you today. It's the Illinois Needs Assessment that we conducted with the thought partnership and leadership and support of the McCormick Foundation. It's a 3-part assessment conducted over 2 years. It involved exploratory analysis, focus groups, and survey. It's unique because this survey includes military families, that is the active duty guard and reserve, in addition to the veteran families who have been studied across this state. During today's event, we're going to share overviews of the result from the Chicagoland and Illinois Needs Assessment conducted in August of 2021. These results help us understand how we can help our service members and veterans and their families better. Listening is important, and so is storytelling. We know that what is behind the data helps move people and helps us understand with greater fidelity. So I'd like to tell you a little bit about one of the people in our survey and also one of the people who is in Blue Star Family staff here in Chicago. And this is Anicia. Anicia is a Deploy Fellow. She is part of our effort to diversify and expand the pipeline of leaders in our military community. She is funded by McCormick and is part of the racial equity and inclusion work that Blue Star Families is doing to help reach military families of color who we know from our research are not as likely to be aware of the programs and resources available to them. Anicia is a Navy spouse. She grew up in South Africa with her family nearby. Family is very important to her. So as like many foreign-born military spouses, moving to the US was hard. Foreign military families have the difficult challenge of maintaining their relationships far away while trying to find ways to connect to new friends here and connect to a new culture here in the US. Um, One of the exciting findings from our needs assessment in the Illinois community was that veterans and military families living in Chicago and the state of Illinois actually have a higher sense of belonging than military family and veterans do across the state. We are sure that that has something to do with the extraordinary work of the McCormick Foundation, and we like to think that the great work of our chapter is part of that as well. Anicia has a very special role because she is part of creating that sense of belonging for military families here in Chicago, along with our chapter director, Ben. Now it's my pleasure to turn us over to Jenny Aiken, who is Blue Star Family's co-director of applied research, to share the findings. Jenny?
Thank you, Kathy. I appreciate it. And thank all of you for joining us today. This has really been an honor and a pleasure to work on this project, particularly because prior to this, we were not able to find any needs assessment done on currently serving military families. McCormick Foundation had funded a great veteran needs assessment previously, and we were able to really have the opportunity to look at what military families and veteran families in the area need in the wake of the pandemic, and also identify things that were working that we should maintain. So just some quick overview on the survey itself. For those of you who are interested in methodology, please drop questions in the chat. We will have somebody monitoring there as well. But we did field this in August, so right as the Delta variant was taking off. The survey itself was a culmination of really a 2-year needs assessment. So we were building on having explored our military family lifestyle survey, which we did a geographic cross-section of Illinois and explored how families did and did not compare to their national counterparts there. And we had done focus groups. So this survey was really to hone in using that knowledge to understand the unique experiences within Illinois that may not have come out in those 2 previous phases. To that end, we of course had quite a few veterans, active duty, and nearly half of our response rates was around the Chicago area specifically. So some of our key takeaways here, as Kathy alluded to, we are seeing a lot of good news coming out of Illinois, particularly when we compare the sample to our national sample. So that's a great indication that many of the efforts there are working to some extent. Doesn't mean there aren't areas to grow, but at least some areas that we should maintain and even share lessons outside of Illinois. Also, we have respondents reporting that really local actions that organizations like this call and I'm seeing in the chat pop up were beneficial, and we want to make the case to you that you should continue those efforts. Nevertheless, our respondents are inevitably impacted by the same nationwide issues that affect other military families that trickle down into Illinois. All right, this is the good news. So as we know, we all moved into a virtual environment. I'm here to tell you that virtual environment is critical, particularly when we are looking at usage of social media. And it's even more important when we want to get active duty families connected to resources quickly in their communities. Both active duty and our veteran respondents are going to social media, but active duty is really going there looking for resources. So please continue maintaining a robust social media presence and recognize how beneficial that is to those who you're trying to reach. We also know that education is an issue for Illinois and military families. And of course, this is a nationwide issue. It comes to the top as a issue that is important to military families every year in our national survey. But it is particularly interesting for Illinois because what we saw was that many of our Illinois respondents were actually schooling virtually at much higher rates than our national sample. And yet they were extremely pleased with their experience in the Illinois school system. So virtual doesn't always equate to bad. And again, there are lessons that we can learn there moving forward. Continuing on this virtual engagement being a good thing that we learned from the pandemic, we also saw both in our focus groups and also in our survey that telehealth services are widely utilized by all of our respondent groups, and they're valuable. So this is an area not just for mental health, which I think we often think of telehealth as being a mental health thing. We see that over half of our respondents are using them for physical health appointments, using them for routine therapy. So these are areas that we can continue to try and support and not necessarily roll back as we return to some semblance of normal. And as Kathy mentioned, we do see a greater sense of belonging among our Illinois respondents than we do among our sample. Now, again, not perfect, still room to go to grow, but we do see that higher sense of belonging, particularly in the active duty families. Now, that said, we also see that Illinois is a very attractive place for veterans as they're transitioning out. Those who are returning home, they mirror many times what we see in the national veteran sample, with people being raised in the area. They want to live close to family or coming there for civilian employment opportunities. All right, so that's the good news. Where can we grow? Childcare. This is a national issue, but it is particularly prevalent here in the Illinois community. We do see that nearly 80% of our active duty family respondents can't always find the childcare that they need. They cite lack of childcare as a top issue. And unfortunately, we do see that nearly half of our active duty family respondents report that Illinois is worse or much worse in terms of childcare costs. So if you're looking at ways that you can improve this situation, looking to any innovative approach, I think there is definitely an appetite for it, both at the national level and also at the local level. And this is very important because childcare is a consistent barrier to military spouse employment. Military spouse unemployment and underemployment have been a crisis at the national level for many years now. Childcare is a huge barrier to fixing that problem. So if we want to ensure that our military families are financially stable, fulfilled in their work, desirable to maintain their service commitment, all of those great things that come from having an employed military spouse, you have to address the childcare situation. What does it look like in Illinois specifically? This is another area where we have stats on the slide, but I do want to caveat that it's a little bit of a good news story. So we see here that 20% of our active duty spouse respondents agree that employers in their community are eager to hire military affiliated individuals. You'd love to see that higher, but it means that there are 20% of respondents who think there are employers there who are doing it right. And those are the places you can go to glean the lessons for how to expand this out into the broader community there in Illinois. So we mentioned the telehealth earlier. Healthcare in general, there's still some areas we can improve. We see an what to me was a quite eye-opening figure of 70% of our active duty family respondents reporting that providers that they would like to see are not accepting TRICARE, and that's a barrier for them. So if you are trying to help providers understand the benefits of opening up their network to include these families would be fantastic. And we see a similar trend on the veteran side as well. We also see on the veteran side limited availability and office hours and a lack of specialty providers. So those are also areas where local community organizations can work to help improve the situation. So what can we do? I hope I've built the case that we need to maintain virtual services and community building opportunities throughout. I think all of us, at least within our AR team, we are really excited about the new possibilities for solving many of these longstanding military life issues because of this access to a virtual community. Not to say that we don't need to also get back in person and develop those in-person relationships, but at least trying to maintain these is also an important element here. And also maintaining and expanding the opportunity for building the civilian military divide. We know that the majority of military families don't live on the installations, they live out in the community. And so that means that we need community, civilian teachers, childcare providers, medical and healthcare providers, mental health providers to understand the difficulties and challenges and unique experiences that military families have and incorporate that into the day-to-day, into their day-to-day professions and lives. This does not have to be limited to professional exposure either. Always very helpful to have a coach who understands what your child may or may not have gone through, have a neighbor who gets it and welcomes you when you arrive to the community, religious organizations that open their arms and welcome new military families into their community. Really anything that can proactively welcome military and veteran connected families is going to be beneficial. We see in other research that the shorter time it takes for a military family to get connected and develop that sense of belonging in their community, the better long-term outcomes they have. And so we all play a role in that. And I just deeply appreciate the opportunity to share very high level pieces from the research today. And we will transition now into our panel discussion and then come back around to the research here at the very end. So to that end, it is my absolute pleasure to welcome Christopher Schmidt from the USO and Jim Dolan from Illinois Joining Forces. And of course, my colleague, Cindy Rivera, who is our Senior Manager of Equity and Social Impact Research here at Blue Star. She also helped conduct many of the focus groups and has been deep in the weeds in the research. So I'm sure we'll have lots of questions there. Thank you all for joining me today. All right, there's a lot of information to unpack, so let's get started on that. Chris. 7 out of 10 respondents are members of an online military connected social network. We even had focus group participants who specifically discussed the USO's presence on social media during COVID-19 as a support to both themselves and their family. What best practices did your organization learn during this time, which you recommend other organizations consider when connecting with this community online?
Well, first, hi, Jenny. Hi, Cindy. And thank you all for having us here today. I think, that's a fantastic question. Thinking back to the necessity to switch to virtual is certainly not necessarily a pleasant thing to try to recollect, but it feels good as you work through what worked and what didn't. And like most organizations, we're very grateful to already have social network in place across multiple channels. And when the need presented itself and the question of what was possible was standing right in front of us, we went to, like any good mission consideration, what our resources were, where our populations that we've been serving were engaged with us already, and identify how we could lean into that even further. The obvious took place almost immediately, which was we stayed connected with our audiences and we found new audiences, which in particular for our mission in supporting National Guard and Reserve, who do not have a installation-based community to rely upon. We immediately recognized an exponential growth in our audience without geographic restriction. And I think for anyone, as we're looking at where we've been, where we are, and where we're headed, the intersectionality between the virtual and the physical program delivery is obviously a very robust conversation for all of us right now, and one that we embrace wholly.
That's great. And how do you plan to maintain this virtual community as in-person events begin again?
Well, I think it starts with listening to our audiences, as has been said already. I think for all of us, understanding from our commands, from our military families, from our service members, where the need lies, and building our programs to respond to that. And obviously the information that Blue Star Families is able to present for us for consideration, not just now, but for historically and into the future, will continue to drive that in complement with listening to our audiences that we serve day to day. And so for us, the challenge is to embrace the potential for growth within the virtual space, while at the same time, as you've said, returning to normal and seeing each other in person, embracing that. And we're beginning to find a balance there. And unfortunately, we're not out of the woods yet with the COVID pandemic, and HEPCON levels continue to fluctuate from installation to installation. Directives from base commands to service members and their families vary from installation to installation. So it's a very dynamic environment within which we're operating, from here at Naval Station Great Lakes in Northern Illinois, all the way down the Rock Island and out west to Camp Dodge in Iowa. So we're listening and planning and strategizing and deploying based upon each of those unique environments.
That's great. Our data tells us obviously that this benefited military families, but did your organization derive any benefits from this renewed engagement or new platform for engagement, expanded membership?
Absolutely. As I mentioned, not only did we reach new audiences within the service member and military family community without geographic boundary, using the virtual platforms, and by transference, we reached new supporters and new audiences, and re-engaged with many. That the veteran communities across the state of Illinois are wide and varied. Everyone, we certainly see that day to day. We study that as we watch those populations shift over time, and being able to get to locations in delivering programs virtually, and then in doing intake for program delivery with some on the ground deployment through the COVID testing sites and vaccination sites and support of the National Guard, allowed us to get in front of supporters that were new and some that were returning.
That's great. And I'd like to call on everybody in our chat also, if you're joining us on Facebook or live, if your organization has learned any lessons about how to engage with this community online, please drop those lessons in the chat. This is a learning forum, and we'd love to learn from each other. Thank you so much, sir. Okay, Jim, shifting over to you. Among survey respondents, we see that 65% of active duty and 42% of veteran family respondents reported using telehealth services. As Joining Forces Illinois helps service members, veterans, and their families navigate resources, how did the expansion of telehealth services during COVID-19 impact the work you do? Oh, you're on mute, sir.
Yeah, you'd think after 18 months of this or so that I would know how to take the mute off. But first of all, I just wanted to thank you and Kathy and certainly McCormick for supporting this work. I think that it's critical that we hear, as Kathy said, and as Chris reiterated, that we listen to the veteran and the military community and get information from them rather than go on our own assumptions. So for Illinois Joining Forces, the pandemic obviously was disruptive, but the upside of it was that because of the number of online platforms that exist now, we've been able to connect veterans and their family members to services, especially in rural communities that they otherwise would not have had access to. About 24 months ago, I was involved with a number of healthcare providers, and they all had telehealth in some form on their roadmap. And the pandemic really just pushed it over the top. So even small organizations who didn't have the infrastructure or the resources to provide remote or telehealth services are now able to do that. So for Illinois Joining Forces, since we do cover the entire state, we often found ourselves in a situation where we could not connect a veteran in a rural community to services. And so especially for behavioral health, for peer support, the number of organizations that now are proficient in providing that online has given us much greater access, and we're able to plug veterans and their family members into those services. So it's really the only upside that I've seen to the pandemic. And I think it will continue. I think we're going to see a hybrid. There was a time when teleconferencing or Zoom was not offered for in-person events because they thought that would depress attendance. What we're seeing now as we're shifting back into kind of a hybrid, it hasn't depressed attendance. People who want to meet in person are, people that are able to meet in person do, but those who would prefer, either because they're further away or just are too busy to get to a meeting, are still attending those meetings. So especially with telehealth, it's helped us to be able to plug veterans into those services.
I'm glad that you're mentioning plugging veterans in, because one of the things that struck Cindy and I as we were going through the data was really this gap, and seeing that veterans and veteran families actually lag behind their active duty counterparts in our survey regarding their use of telehealth. Do you have any thoughts as to why this might be and how the gap could be closed?
Yeah, I do. I think that in general, the veteran population, as opposed to active duty, Guard, or Reserve, is much more fragmented, much more fractured. When veterans return, they return oftentimes to their own hometown. They're not connected to their military units as they once were. So I think access to veterans in general is more difficult because of that fragmentation. I don't know that there's necessarily a bias against telehealth when it comes to veterans. I think there is an issue when it comes to older veterans who aren't comfortable with the technology, number one. For behavioral health in particular, I still think that there are a lot of veterans, there are a lot of people in general who would prefer to have that personal connection, right? To meet face to face. But I think that the major issue is making sure that veterans as a community are aware of those services. And because of the fragmented nature of the veteran community, it's much more difficult to get that message out.
Yeah, we're seeing that awareness kind of across the board too. I think helpful context of national research that can filter down to the local level. Although we didn't really have the numbers that we needed to be able to cut this data by race and ethnicity, what we do see at the national level is that individuals who have at least one racial or ethnic identity that other than white do have a more difficult time accessing resources. So that's something else those on this call may want to continue to monitor within their own organizations moving forward to make sure that we have at least some parity in outcomes there, to use a little bit of jargon. All right, Cindy, we see that 1/3 of active duty family respondents and 49% of veteran families agree that they feel a sense of belonging to their local or off installation community, which is higher than our national average of 27%. Can you tell us a little more about how different groups rate their sense of belonging? Specifically, tell us a little bit about what you learned in the National Guard focus groups that you conducted.
Yes, of course. Thank you for this. When this stat came up, this was so wonderful to see that during a time of physical isolation, that people were feeling like they belonged to their communities. And as we conducted the focus groups, we conducted them geographically, one in mid-state and then one near Scott Air Force Base and then one in the Chicagoland area. So naturally, it actually became one National Guard / Reserve focus group, and the other two were more active duty participants. And what we heard a lot in that National Guard Reserve focus group was a sense of disconnect between the local community's understanding and ability to respond to their needs during, transitions and deployments, compared to what we were hearing in the other two focus groups. There seemed to be some stark differences, like my children's school doesn't understand what's going on with my child, and there's no one that we can connect to. I don't know any other service member or organization that would work with us here locally. So this was some of the senses that we were hearing from these National Guard families. And I think that when we look at this data, you know, it would be lovely to have a sample larger to see where those belonging differences are different between active duty and then National Guard and reservist. We just didn't have the number at this point, but we had what we heard in the focus groups. And we also heard things in the focus groups near Scott Air Force Base in Chicago, that things like homeschool groups and the USO, both in person and online events, we're really helping families feel this sense of belonging and get connected quickly. That's what one participant particularly was speaking about, her homeschool group and how it integrated her so quickly into the community. And she was especially happy that it wasn't just military families, that it was civilian families too. And this meant a lot to her. And I think this is a model of how these groups that can come together that are mixed military family and civilian can really bolster this sense of belonging for active duty spouses. And then how do we replicate this type of stuff in National Guard communities that may not have that infrastructure or ability to do that as easily?
Thanks, Cindy. I do want to pull in a question from the chat here, not the Facebook chat, the Zoom chat, asking if we have any statistics that highlight how many military spouses are looking to entrepreneurship to combat these unemployment and underemployment challenges. We don't in this study, but I can direct you, I believe it would be the 2017 or the 2018 Military Family Lifestyle Survey on the Blue Star Families website. And another organization that has a lot of great research around this is the Institute for Veterans and Military Families at Syracuse University. And also Hiring Our Heroes might have some research. So we may not have it for Illinois here, but you can go look at those national statistics and learn from those recommendations as well. Okay, so we have a couple of minutes left. I would like to open the floor to all of you, actually, if you have any final comments or anything that struck you that we didn't get to in the questions that we teed up. Jim.
Well, Jenny, thank you. In fact, this is aside from the questions that you asked, it goes to the report itself under opportunities and growth. I just wanted to confirm for you, one of the things that we're seeing, this is outside of telehealth and outside of some of the things that we've discussed, on that page, you indicate that respondents most commonly reported financial stressors as, and one of the top ones you have is major home repairs. Among active duty, it was 14%. Among veteran respondents, it was 42%. And I just want to confirm that number. That is one of the top requests that we're getting. And I think in large part, it has to do with the aging veteran population, especially Korea and Vietnam veterans, as they're not able to maintain their homes as they once did. Certainly, it's a social determinant of health, the quality of the home in which you live, the quality of your residence. That 42% did not surprise me. But so I just want to confirm that that stat seems right on point with what we're seeing, veterans needing home repair because they simply haven't been able to maintain their homes as they once did, and they're falling into disrepair. So just a confirmation on your research.
I really appreciate that, Jem, because sometimes for us, like looking at that, it can be like, wow, I didn't expect that. You expect to see things like credit card debt and those types of things. But I think that context is extremely helpful. And I am, thank you for validating it for us. I think it's also important context within the broader current housing market that individuals who may have been looking to rent or sell their home or purchase a home are now facing a lot greater difficulties or challenges in the price. So you are investing more in your own property. So just a really interesting thing. I want to continue, the researcher in me wants to continue to monitor that in the longer term to see if that holds as well.
Well, I think you'll see what we're seeing is that it all falls under financial insecurity, right? But it manifests itself, it displays itself, it shows up as a symptom elsewise, right? So it could be home repair, or it could be food insecurity, but it all delves back into too much month at the end of the money for a lot of veterans and military, active duty, guard, and reserve. So you need to dig a little bit deeper to see why it is that these things are popping up. Most of them have their root in financial insecurity.
Yeah, thank you. And it's also a good reminder for those of you watching in, the stats that we presented on the slides are not the full report. The full report is available on our website and has a lot more information. Christopher, over to you for any final remarks.
I would just offer that I think we're encouraged by the findings and inspired, and there's the obvious call to action associated with that, both individually and collectively. So thank you, Blue Star Families, for this deep dive. I look forward to more. I'm very eager to share this with our contacts with the Illinois National Guard. And again, with a call to action to not only cultivate more information, but to figure out, where the additional needs are. And then I think most significantly, I also pay tribute to the community of organizations that is the fabric within Illinois, and without the McCormick Foundation and Megan as the convener of those like-minded organizations and individuals, I don't think we would have recognized with the progress that we're making, that we're seeing through this data. And I'm inspired to continue to contribute to that community and see where that road takes us all. The goodwill is a wonderful fuel in the engine.
Yeah, it's rare that we get to always focus on the good news stories. So I do hope that those of you on this call can kind of take a moment to give yourselves a little bit of a pat on the back, instead of, there are always going to be problems in this work. There are always going to be challenges. But taking that step back and recognizing that achievement is so important as well. So thank you for highlighting that, sir. All right, Cindy, any final thoughts?
Nothing else. And it's been a pleasure to learn a lot about Illinois and military families and veterans. And it's been lovely to see all the organizations and the good work you do, and kind of putting data points behind why it's so necessary. And I hope that we'll be able to continue our partnership in the future.
So we're asking many of you to really step into this and take some action on your part to either maintain or make more robust your virtual connections in your communities, to really take efforts to bridge that civil military divide. Here at Blue Star Families, we wanted to share some of the work that we are doing as well. We did share with you a little bit, Kathy discussed our Deploy Fellowship program. McCormick is supporting that. McCormick is also supporting a couple of other initiatives that I'd like to go through. If you could go to the next slide, please. This is Christina. Christina is another McCormick Foundation fellow. She's been working with the National Guard over the past couple of years, and we're just really grateful to the work that she's been doing there. So if you could drop some thanks to Christina in the chat, that would be fantastic. We're so grateful to the work that she and Anisia are doing with Ben, who's our chapter director there on the ground. So I'm very excited about this. One of the things that the McCormick Foundation asked of us when we started this research was not to just do the study and then hold the data and not be able to share it. So we're trying something new out. This is in beta form, so you'll continue to see some improvements over the next couple of weeks, but we are trying to make this data available to you and your organization so that you can use it to explore various questions that you might have regarding these communities. So we have posted this data to Tableau Public. You do not require a Tableau account to go and explore these dashboards. This is a screenshot of what that might look like. If you do hold your phone up, that little QR code there should get you there, with a caveat that it isn't, I don't think it's quite optimized for mobile yet, but please let us know if you have feedback on this. Again, it is a new initiative for us. So we are there. If you would like a copy of the full data set and you have your city training, which is another researchy thing, then that's something else you can contact us to explore. We will provide a de-identified data set to those individuals. So I'm going to drop my email address here in the chat in a few minutes, and you can just reach out for that. So the other piece of the Blue Star Families role in all of this is our Blue Star Families chapter. Ben Gold, many of you may know, is our chapter director there in Chicago. And we do believe that our chapters help provide the building blocks towards belonging for military families. And we've got a lot of research at this point to back that up. So I'm excited to share with you a short video to help us recenter ourselves in the lived experiences of military families as we move on for the day.
Blue Star Families keeps growing. We now have over 260,000 members, over 250,000. We have 11 chapters, and I'm looking forward to when we have chapters in every state. When we're everywhere you go, then you always have someone with their arms open wide to catch you. When people move again and again, and they're moving next to neighbors who might not know they're there, it can be lonely. Things can be tough. You need at least one person you can turn to so that problems don't get worse. We started asking questions about belonging. Do you feel a sense of belonging in the communities in which you live? And nearly half of folks said no, they didn't, but they would like to. And a full third of the folks in our survey said they didn't have a single person to whom they could ask a favor, but of course they wanted that person. Look, it's a pleasure and a privilege to serve your country, but no one's going to do it if it hurts their family. Because as much as we love our country, we also love our family, and we have a responsibility to them as well.
I am an Army veteran. My husband is on active duty. I have 2 children. We've lived in 5 different states. I would say the hardest part is definitely not seeing my mom as often. This last move was probably one of my hardest moves. No one was there to help me navigate or just kind of be the buffer. I have a friend who, she actually is the Blue Star chapter director. She said, try this program. So, we'll do a little research. And I said, okay, this is something I'll be interested in. So I tried it out, and little did I know that day was going to be life-changing for me. I met my friend Brandy. I love being with my family. I love being with my kids, but I also need an outlet from that. I just needed one friend. That's it. Just one. Just to know that you have somebody you can count on to come through when you need it. By having those connections, that relationship within Blue Star Family, it also helps benefit and support my community.
Blue Star Families being a trusted place for resources, guidance, and important information that people can turn to and trust has a significant impact on so many military families. Through our events and programming, Blue Star Families is able to address critical issues that military families are facing, like establishing connections, combating food insecurity, and tackling spouse unemployment and underemployment, which has a real effect on their quality of life. We're able to bring military families together. We help them create relationships with their neighbors and provide them with a sense of belonging in their community. We remind them that their sacrifice isn't unnoticed. It means so much to so many people in their community and to our country as a whole.
Blue Star Family supports military families in ways that strengthen local communities. Our funders need to know that their dollars make a difference, not only for that family, but for the community as a whole and for the strength of the country. We welcome everyone who can join us to be part of this important mission. Well, I hope you enjoyed that video as much as I do. I just love seeing those kids. And Ben, it was great to see you with the chapter. And I saw Sarita Connolly, our original chapter director, in one of this screen. So that was great. I hope all of you are on this call. Join us at some of our events because they can really be very heartwarming. I want to thank all of our attendees. Fantastic involvement. Fantastic to hear your names and see your the work that you do in the community. Thank you so much, McCormick Foundation and Megan Everett. We couldn't do this work without you. You guys are such leaders. Illinois Joining Forces, USO, you guys have been our big siblings in coming into Chicago, and we are grateful to you for all the ways you have been such fantastic partners. Please reach out to us via email or in the chat to learn more about the research. We'll be sending you a post-event email. We want to hear your thoughts about what we're doing and what your recommendations will be. Please reply to us. We look forward to continuing this work together. It's such a pleasure to spend this time together, and perhaps soon we'll do it in person. Thank you all.